How do you recognize internal bleeding? Have you ever wondered how to spot something as serious as internal bleeding? It can be tricky, but knowing the signs can make a big difference in an emergency. Internal bleeding happens when blood leaks from blood vessels inside the body, often due to trauma or injury. It can be life-threatening and needs immediate attention. First, let's talk about some basic signs and symptoms. If someone has pain at the site of an injury, that could indicate internal bleeding. You might also notice swelling or a feeling of tightness, especially in the abdomen or chest area. Bruising or discoloration on the skin can appear hours or even days after the injury. Keep an eye out for visible bleeding from body openings. This could include blood and vomit, which suggests an injury to the lungs or digestive tract. Blood in urine points to a urinary tract injury. If you see blood coming from the ears or nose, that could indicate a head injury. Blood from the anus may suggest a bowel injury. Now, internal bleeding can lead to shock, which is a serious complication. Signs of shock include pale, clammy skin, weakness, or feeling faint and dizzy. Rapid, shallow breathing and a weak pulse are also red flags. If someone seems confused, drowsy, or loses consciousness, that is a serious concern. Extreme thirst and cold extremities can be additional signs of shock. The symptoms can vary based on where the bleeding is happening. For example, if there is abdominal internal bleeding, the person may experience severe abdominal pain, swelling, nausea, or vomiting. A rigid or swollen abdomen is also a sign. If the bleeding is in the chest, the person might have chest pain, difficulty breathing, or cough up frothy or blood-tinged sputum. In cases of head injury with internal bleeding, look for headaches, dizziness, confusion, or memory loss. Any wounds on the scalp or face can also be a clue. If you suspect someone has internal bleeding, treat it as a life-threatening emergency. Call emergency services immediately if possible. Lay the person down and elevate their legs above heart level to help blood flow to vital organs. Keeping the person calm and still is important to avoid worsening the bleeding. Do not give them anything to eat or drink, as they may need surgery. Continuously monitor their breathing and consciousness. If they show signs of shock, cover them with a blanket to maintain body temperature. Remember, internal bleeding may not show symptoms right away. Even minor trauma can lead to serious internal bleeding. Early recognition and prompt action can save lives in emergency situations. Being prepared and knowing these signs can make a real difference for you and your family.